is on cancer, and so I'd like to dedicate this speech to her. In October of 2013, I discovered that I had an odd-looking mole. Now, my doctor took a look at it and worriedly told me that the mole had several characteristics typical of melanoma, a type of skin cancer. This scared me, but fortunately it turned out to be a false alarm and I don't have cancer. I have, however, known many people close to me who have struggled with cancer. I actually began writing the speech in the midst of my 19-year-old cousin Madeline's battle with melanoma. She fought valiantly for the past 2 years, never giving up hope and inspiring all who knew her. When she passed away this last December, I considered giving up on the speech. But I think it's important that we learn more about a subject that affects so many of us and our loved ones. So today, I'll be talking about cancer, the science behind it, the treatments, and the role of the internet in supporting cancer patients. The source for most of the information I'll be sharing today comes from the American Cancer Society and from my family's experiences. Cancer has affected not only my family, but also many other individuals and families. According to the Center for Disease Control, cancer is the second leading cause of death in the United States, second only to heart disease. However, the outlook for people facing cancer today is much more favorable than it used to be. Since the 1970s, the cancer survival rate has been steadily increasing, and there are now more than 11 million cancer survivors in the United States alone. First of all, cancer is not a new disease. Cancer has actually been documented throughout much of recorded history. The earliest description of it was found in Egypt, around 3,000 years before Christ, and it was noted that at that time, there was no cure. So then, what exactly is cancer? Well, at its most basic level, cancer is defined as the out-of-control growth of abnormal cells. But how does this come about? Well, first we should look at how our cells normally operate. Inside every cell in your body, there is DNA, which is like an instruction manual for your cells. However, sometimes the DNA in a cell can get damaged or changed. This is called a mutation. Now, most mutations are harmless, but some can be dangerous and lead to cancer. There are two ways these cancer mutations can happen. Some mutations are inherited and some are acquired. Inherited mutations happen when a parent has a cancer mutation that is passed on to their child. It is actually surprisingly rare for this to happen. Inherited mutations are a major factor in only about 5 to 10% of all cancers. Acquired mutations, on the other hand, were not present in our original DNA, but they happen sometime later in our lives. These mutations occur in one cell, and then are passed out to that cell's offspring as it divides. An example of this could be a mutation that happens as a result of someone smoking. Acquired mutations are much more common than inherited mutations, and most cancers are caused by these. But fortunately, acquired mutations can't be passed on to your children. Now, it's important to realize that no single mutation, acquired or inherited, causes cancer. In fact, it takes at least one or more additional mutations in the same part of the DNA to make a cell become cancerous. So even if a mutation is already contained in your DNA, you're more susceptible to developing cancer, but fortunately you may never actually get it. But what causes the mutations that can lead to cancer? Well, in the news today, we are often hearing about things that might cause cancer, such as cell phones, plastic bottles, or even using deodorant. But according to the National Cancer Institute, there is much stronger evidence to support risk factors such as tobacco use, sunlight, radiation exposure, certain chemicals like asbestos, overconsumption of alcohol, heredity, and certain viruses and bacteria. The biggest risk factor, however, is age. The longer you live, the more time mutations have to build up. That's why cancer most often shows up in people who are older. Now, it's important to keep in mind that some people will be more sensitive to certain risk factors than others, and that many people who are exposed to these risk factors will never actually develop cancer. We've talked about what causes cancer, so now let's look at some ways to treat it. To understand this, we need to look at how our bodies normally fight against infection. The best way to do this is to think of your body as being a walled city, which is made up of normal cells. It has soldiers, your immune system, who are able to recognize and defeat any foreign invaders, such as viruses, because the viruses are very different from normal cells. Cancer cells, on the other hand, look almost identical to normal cells. In this analogy, the only difference is that the cancer cells wear bow ties. So your immune system has a hard time recognizing these cancer cells as being threats. This means that the cancer is able to avoid detection, grow, and multiply. Once cancer cells have multiplied, they can find their way into key positions inside the city. They may start in one place, but can travel around your body through either your bloodstream, which is like your city's water supply, or your lymph system, which is like a road network, which transports your immune soldiers. If left unchecked, cancer cells can travel through either of these systems and go anywhere they want to within the city. Now, there are a number of valid treatments that can be used to try to stop these cancer cells, but I'll be talking about the four major ones: surgery, radiation, chemotherapy, and immunotherapy. Say, for instance, that a cancer cell begins here, and then clones itself until it reaches a noticeable size. Then the best thing to do is to surgically remove it before it gets a chance to spread. If, however, there's a chance that the surgery didn't remove everything, you may need to use additional treatment. The next type of treatment to use in a specific area would be radiation. Radiation works by killing cells that are actively dividing, which means that cancer cells are quite susceptible. In the early days of radiation treatment, radiation was less precise. It was more apt to harm normal cells as well as cancer cells. With advances in technology, however, scientists can now use computerized 3D imaging to zero in on the specific area where the cancer is growing. This means that they can direct radiation precisely at the cancer from multiple angles, meaning that the cancer can be destroyed with the least amount of collateral damage. But what do we do if the cancer is spread into the water supply or the road network? It could be anywhere, so we need to use a treatment that will cover this entire system rather than just one area. That's where chemotherapy comes in. With chemotherapy, special drugs are given that go throughout the entire system and kill fast-growing cells, like cancer. More than 100 different chemotherapy drugs have been developed to successfully fight cancer. Now, the downside of chemotherapy is that it also kills other fast-growing cells, such as blood cells, hair follicles, and more. But chemotherapy is one of the most effective treatments in the fight against cancer. The final kind of treatment I'd like to talk about is immunotherapy, where powerful drugs are given to stimulate an immune response. This type of therapy is changing the face of the battle against cancer. In fact, Science magazine named immunotherapy the top breakthrough of 2013. While chemotherapy fights cancer cells directly, immunotherapy equips your own immune system to fight cancer. Immunotherapy can turn up your immune system and help it to specifically identify the cancer cells as being threats. This type of therapy is like giving your immune system a magnifying glass, so it can see those bow ties and recognize the cancer cells as being invaders. The downside of immunotherapy is that sometimes the immune system can get a little overzealous and attack the good cells along with the bad. But immunotherapy is now bringing new hope and healing to many cancer patients. Now that we've discussed treatments, I want to talk about how cancer patients can gather support during their fight against cancer. The internet has definitely revolutionized this. Websites such as caringbridge.org make it easy for families to set up an informational blog that is both free and easy to use, even if you're not very computer literate. My family personally used Blogger to create a website that kept family and friends updated on my cousin's condition. We also used other free sites, such as takethemameal.com, to help organize meals for the family. A church member set up a fundraising website through youcaring.com that helped raise money to pay for my cousin's treatments. And finally, through Facebook groups, we were able to connect with other cancer patients with the same type of cancer as Madeline from all across the country. This enabled us to find new treatments and hear about responses and side effects from others who are going through the same thing. Now today we've talked about cancer. We've seen the science behind it, the treatments, and the role of the internet in supporting cancer patients. A struggle with cancer can be unbelievably difficult on those fighting cancer as well as on their family and friends. But God can work even in the midst of cancer and bring a deeper perspective on life. It has now been almost 6 months since my cousin Madeline passed away, and I'd like to close the speech with a quote from her, which means a lot to me. Being diagnosed with cancer has made me realize what is important and what truly matters in life. Life is so precious. precious. Don't take a single day for granted. Tell people how much they mean to you. I am so thankful for my family and friends. I'm thankful for the doctors and the treatments that I've been given. Life isn't always easy, but we have so much to be thankful for. God is good. Today, I hope you've gained a better understanding of cancer, which is something that affects so many of us and our loved ones. Thank you.